You guys are still doing what you do, but things have changed just a little bit. Tell us how this food bank is running now.
Yeah, so we are still offering food for our clients in need. We're doing pre-made bags right now, and there's actually more food in them than people would typically get if they were to go through and shop themselves. And we're actually doing station outside of the actual building, so people don't have to come into the food bank. There's less contact, and at the same time, we are also restricting the number of volunteers and staff that we have in at a time. So things are going a little more slowly right now, but we are still here to serve. Also in the food bank, our basic needs program is still providing a few of its services. Housing and utility assistance is available Monday mornings when callers contact between 9 and 11 a.m. They just call the food bank and let us know that they have a rent or utility bill that's coming past due, and we can help out with that. And then on the donation side of things, so this definitely looks different for us. We're talking social distancing, we're talking wash your hands and everything, sanitize surfaces, but when it comes to items like cans and boxes of food, it's a little more difficult for our reduced staff and volunteer base to be able to accept those, sanitize, sort, and stock. So we are currently not accepting food donations, and I think that's pretty similar across the board for a lot of food pantries. We're reducing the contact and making sure that the products that we take in are as clean as possible.
But you are taking monetary donations, right?
Monetary donations is the way to go right now. Every dollar donated, we're able to purchase 5 pounds of food through our bulk supply lines. So your dollar really has its greatest impact there. And we are suggesting if folks have something they want to donate to us, they just hold on to it for a little while. And hopefully once this all passes, we're able to start accepting those again. And then things like, online ordering, Amazon, Hy-Vee's, Aisles Online, those things, we are still accepting donations from mail carriers and delivery drivers.
So we could place an order on your behalf and then have that donated and delivered to you.
That's correct.
Julia Erickson joining us from CommUnity, formerly the Crisis Center. They are based out of Iowa City. Julia, when we're talking about your food bank program, specifically, what's kind of the geographic footprint? Who are we talking to from your clientele standpoint?
Yeah, absolutely. Anyone in Johnson County can come to us. Our partners at Coralville and North Liberty, we've all been working really closely together. Oh, and I See Compassion is another small pantry in Iowa City. We're working together to make sure service kind of looks the same across the board at this time. And we just started offering delivery yesterday. So clients that can't make it to any of our pantries or might be at higher risk for contracting COVID-19, we're encouraging you to stay home and give us a call, and we will deliver your groceries to you within about 48 hours.
That's kind of amazing. And I imagine that you might be seeing an increased need for the food pantry. So thank you guys for making that switch and getting things up and running as safely as possible.
We're happy to serve. Yeah, and we couldn't do it without the very generous folks in our community. We're just humbled by the support we're seeing at this time. And we know that we're not at the end yet. So the support at this time really, really is needed. And we'll see what comes in the next couple of weeks.
And the food bank isn't the only part of the services that you guys provide. You also have like mental health services as well. How is that all working?
Yeah, so we have kind of transitioned to all remote for our crisis line, but we are fully operational. People can call, chat, or text 24 hours a day, and our trained volunteers and staff will talk with you. We also have a mobile crisis outreach unit that is kind of determining on a case-by-case basis if they're dispatching or using telemedicine to counsel folks in need. So those services are still available. We know that isolation is a key determinant in mental health. And when we're being told, in our very human nature is to be together and be social. And when we're being told to isolate ourselves, distance ourselves, right now it's kind of a honeymoon phase, but as we move through the rest of this pandemic, we'll start to see some folks reaching out with more severe mental health issues. We are seeing an increase in our disaster distress helpline, quite a large spike there, but otherwise, we're always accepting volunteers. We always need folks on that line. So if you've got some free time right now, we'd highly encourage you to visit our website and sign up for that online training. You can do it completely at your own pace.
Have you had any trouble with the phrasing of social distancing? Because so many people, we're trying to physically stay away from each other, but we do, like you said, we're humans and we have this need to emotionally connect. So we need to make sure we're still connecting, right?
Yeah, so our director of mobile crisis outreach will actually be joining the Johnson County Public Health Press Conference this afternoon, and she's going to be talking about a variety of ways that we can connect still at this time, make sure our mental health is a top priority. So definitely everything you just said, Claire, we're all on Zoom and FaceTime and Google Hangouts now, so invite your family and friends to those. We've seen so many folks doing virtual game nights, maybe a happy hour, or even, maybe don't go to someone else's house, but if you just step out on your balconies like they're doing in Spain, there's plenty of ways to keep connected.
I have shouted at my neighbors more often than not from my back deck across two backyards to their back deck.
My kids look forward to seeing somebody outside. Like, the neighbors are outside. Let's go say hi.
How are your dogs doing today? Julia, you've given us so much great information, and I want to make sure that we can give just one point of contact because we've got a food phone number, your crisis text number, which is really important, is a different number. Can we route them to just one location? Is your website the best spot for that?
The website is the best. Great idea. So we have kind of a constantly updating resource website for the COVID-19. So it's builtbycommunity.org/COVID-19. And you can find all that information, even if you're just on the home screen. There's a banner across that says we're open. And,
you can't miss it.
You can't miss it.
Yeah, it's right there. Julia Erickson, Community Crisis Services and Food Bank, because we've hit two very important things this morning. Claire and Julia, thank you for that information on the food bank delivery system and how people are making donations specifically in the Johnson County area. But it's great, Julia, because all of the things we're talking about from a crisis standpoint, just wanting to reach out and touch and talk to somebody, you guys can do that in a broader footprint by providing these services.
Of course. Thank you guys so much for having me on.
Well, thanks for joining us this morning on the Morning Scramble, Julia.
You guys are still doing what you do, but things have changed just a little bit. Tell us how this food bank is running now.
Yeah, so we are